Since March is the Colorectal Cancer Awareness Month, today we are going to talk all about colorectal cancer screening. My name is Shrishti Sharma. I'm a board-certified preventive medicine physician, and I am here to talk about all things prevention, all things screening, and all things health. Colorectal cancer is the third most common cause of non-skin cancers in men and women. The first two common type of cancers in men are prostate cancer and lung cancer, and in women it is breast cancer and lung cancer. Colorectal cancer, however, are the second leading cause of death in men and women in the United States. In 2024, there were over 150,000 cases of colorectal cancer and more than 50,000 people died of it. As the name suggests, colorectal cancers are cancers of the colon or the rectum. Most of colorectal cancers begin as an abnormal lesion on the inner surface of either the colon or the rectum. These lesions can be a flat lesion, they can be slightly raised, or they can be a protrusion, which in scientific term is known as a polyp. These polyps can simply appear as a protrusion on the inner lining of the colon or the rectum, or they can be attached to these linings through a stalk. Though these polyps can appear at any time, most colorectal polyps are common in people who are above 50 years, and most of them do not turn cancerous. Increasing age is a major risk factor for colon cancer. In fact, most of the colon cancer is diagnosed between the ages of 65 to 75 years of age. The good news is that the rates of colon cancer is decreasing for people who are over 65 years of age. Having said that, the rates of colon cancer is increasing significantly for people who are above 15 years of age. Why is the rate increasing in younger population? At this time, we don't know for sure. It could be just that the prevalence of risk factors is increasing in younger age groups, which is why the risk of colon cancer is increasing as well. What are these risk factors? As I mentioned, increasing age is a risk factor for colon cancer. Having said that, other risk factors that are strongly associated with colon cancer include some inherited conditions that causes polyps in the colon and the rectum, family history of colon cancer, and a personal history of inflammatory bowel diseases like ulcerative colitis or Crohn's disease. In addition, personal risk factors that increase the risk of colon cancer include cigarette smoking, heavy drinking of alcohol, obesity, decreased physical activity. All of this can increase your risk of colon cancer. Based on all this information, you can see why it is important to screen for colon cancer. So, what are the recommendations? How often should you be screening for colon cancer? The US Preventive Services Task Force has recommended that every person over the age of 45 years begin screening for colon cancer, and they continue screening until they are 75 years of age. Between 75 to 85 years of age, screening should be a personal decision that you should take after consulting with your physician. USPSTF recommends that after 75 years of age, there is no major benefit of screening for colon cancer. The frequency with which you screen for colon cancer depends on the method of screening that you use. There are three major ways to screen for colorectal cancer. The first is stool-based tests. The second is direct visualization of the colon and rectum. And the third is blood-based tests. Let's talk about it in a little bit of detail. Stool-based tests essentially look for blood in the stool through different methods, or they can look for changes in the DNA in the cells that can be found in the stool. Stool-based tests are pretty easy and inexpensive to do. They can be done at home. There is no risk to your colon. No changes in diet is needed prior to the test, and you really don't need to go through any prep work for these tests. But these tests can sometimes miss some kinds of cancers, some kind of polyps. These tests have high false positive rates, which is to say that a test could say that you could have cancer when you may not in reality have cancers, which is why every positive test for any kind of stool-based test is followed by a colonoscopy to confirm the diagnosis. Also, because of all these issues, tests need to be done every year. The other type of screening test for colorectal cancer is through blood tests. Currently, there are two FDA-approved blood tests for colorectal cancer. These blood tests look for cancer or precancerous cell in the blood. Having said that, these tests are more accurate in detecting colorectal cancer rather than precancerous lesions. If there is a positive finding in the blood test, you will need to undergo a colonoscopy for confirmation of the diagnosis. These tests are also relatively safe because you're not undergoing an invasive procedure like colonoscopy. You're not doing any kind of prep work. You're not changing your diet. You're not changing your medication before you do your test. But the test can miss some polyps and some cancers, so you would have to go in for an annual visit to the clinic for a blood draw for screening for colorectal cancer. The final type of colorectal cancer screening tests include direct visualization of the colon. This can be done through three methods. One, through colonoscopy. Second, through a CT scan of the colon called CT colonoscopy. And the third one, which is not quite frequently used, but it can be done, and that's called the sigmoidoscopy. All of these tests are done in a doctor's office and require a full bowel prep. That is, you need to empty your colon and your rectum from any stool so that there can be direct visualization of any lesions. Colonoscopy is done by a physician, usually a gastroenterologist, who will put in a scope through your rectum and visualize your entire colon and the rectum. At the time of examination, if your gastroenterologist or your physician sees some lesions, they can remove the lesion at the same time as doing the colonoscopy. After they remove the lesion, they send it to the pathologist for a biopsy to see if that lesion is cancerous. Because this is an invasive procedure, there is a risk, although very low, of tears, bleeds, infections, or general injury to the colon and the rectum while the procedure is being done. The good thing though is once a colonoscopy is done, you don't need to repeat it for another 10 years. Oh yes, and the procedure is done under sedation, so you will most likely not know what is happening when they're doing a colonoscopy. Next screening test is a virtual colonoscopy or a CT colonoscopy, where essentially the colon is visualized through a CT scan. In virtual colonoscopy or CT colonoscopy, the entire colon and the rectum is visible, but sometimes small polyps may be missed. Because this is a CT scan, if they do end up visualizing a polyp, it cannot be removed at the time of the procedure. So you would have to undergo a colonoscopy as a follow-up so that the polyp can be removed and sent for testing for malignancy. This is a non-invasive and a fairly quick procedure, though you will be exposed to some degree of radiation while you go through your CT scan. Because small lesions can be missed in virtual colonoscopy, you need to repeat the screening method every 5 years. And because this is a CT scan of your abdomen and pelvis, organs other than your colon will also be visualized. And if there is a lesion that is seen during the CT scan, then it may require some additional follow-up. And finally, there is sigmoidoscopy. In this procedure, a scope is placed into your rectum and it looks at the lower third of your colon and your rectum. So essentially, the entire colon is not being looked at, which is why this is not really an effective colorectal cancer screening, specifically because some lesions can arise in the first 2/3 of your colon. It is not popularly used as a screening method for colorectal cancer, but yes, it can be done. If any lesions are visualized in the lower third of the colon or the rectum, then they are removed and sent for biopsy. But again, since the upper 2/3 of the colon is not visualized, lesions out there can be missed. Again, this is an invasive procedure, so there is a small risk of tear or infections or general injury when you're doing a sigmoidoscopy. So if you are screening using sigmoidoscopy, you need to screen every 5 years. Among the newer screening methods, capsule colon endoscopy has shown a lot of promise, and some places are already using this as a screening method. Essentially, in this, you swallow a small capsule that has a camera in it, and as the capsule goes through your GI tract, including your colon and your rectum, and it passes out, it captures images that can give a visualization of any lesions that may appear in the colon or any GI lesion for that matter. If any lesion is visualized, you will need a follow-up with either a colonoscopy or a biopsy of some sort to confirm your diagnosis. It's not widely available, but some places could be offering it. So yes, with this variety of options that are available to you for colorectal cancer screening, there is really no reason why you should not already be screening for colorectal cancer. And that's all for today. I hope you continue to prevent, screen, and stay healthy. Thanks for watching.